next speaker is Dr. Jaqueline Moline. And Dr. Moline, this little preview for later today, Dr. Moline will receive the Irving J. Selikoff Lifetime Achievement Award at the end of the afternoon. Dr. Moline is Professor and Vice President of Occupational Medicine, Epidemiology, and Prevention at Hofstra Northwell School of Medicine. She trained and actually was a faculty member at Mount Sinai for 19 years, where she, among other things, directed the World Trade Center Health Program, moved to Northwell, I don't know, a dozen years or so ago, where she still, in addition to being vice president of the department and school, is also still head of the World Trade Center Health Program. So, Jackie, welcome.
Good morning, everyone, and it's a pleasure to be here. I am going to talk a little bit about what to look out for in terms of asbestos-related diseases. And I thought that that was just such a great intro to this speech, because people often don't know what symptoms might be associated with asbestos-related diseases. And I'm really going to highlight, this is a talk really about prevention and awareness, which is really the mission of ADAO. So currently, the commercial use for asbestos in the United States is somewhat limited, but it's still there. But where it was used in the past was, as Dr. Flores mentioned, in brake pads, clutches, corrugated sheeting, cement pipes, roofing materials, and vinyl tile. Please understand that there were 3,000 different products that contained asbestos in the heyday of asbestos use in the United States. So this is just a brief listing of some of the products where asbestos was used and may still be found. Thankfully, it's no longer in brake pads and clutches, although it may be in vintage cars, and certainly folks who worked on them 30, 40 years ago will have had exposure. Okay, and one of the other elements, actually, Dr. Flores touched on this, is something that people don't think about as much. And we did hear this from Ms. Forgy earlier this morning, whose mom used cosmetic talc that led to her mesothelioma. Cosmetic talc obviously contains talcum powder, as well as loose face powders and other body powders. Industrial talc is something that people aren't aware of its use. It was used in the rubber manufacturing. It's an additive to paints, plastics, ceramics. Often it was used if people were made pottery. It was added as a strengthener to the clay. So what are some of the asbestos-related diseases? There are asbestos-related pleural diseases, and asbestosis are non-malignant. And then there are 4 cancers that are associated with asbestos, and that includes mesothelioma, lung cancer, ovarian cancer, and laryngeal cancer. Asbestos-related cancers come from the inhalation of the fibers, and these are the 4 cancers, as I mentioned. You know, everyone thinks when we're thinking about asbestos and asbestos cancers of lung cancer and mesothelioma, and predominantly mesothelioma, because mesothelioma is what's called the signal or sentinel cancer for asbestos exposure, meaning that if someone has mesothelioma, it should prompt a discussion of where were you exposed to asbestos. And we'll talk about that a little later with respect to the type of history that should be elicited and unfortunately is rarely elicited. So of those 4 cancers, and I think Dr. Markowitz will go into this in greater detail a little later this morning, the only one for which the United States Preventive Services Task Force, which is the government agency that lets us know whether screening tests will be covered by the federal government and in other insurers, is lung cancer screening has been added as being effective. And the age range just has come down to 50 years. It's 50 to 80 years, so that as they've learned more, the age range has been expanded. But it's only for former smokers. and with a certain pack year smoking history, which you can see how you can calculate that. Unfortunately, despite the American Thoracic Society and other professional organizations wanting to add occupation as another risk factor for people who should be eligible for this lung cancer screening, they have not added that. That doesn't mean you shouldn't make sure that your physician is aware of the fact that you had asbestos exposure, because you are at increased risk for lung cancer if you've had asbestos exposure. Lung cancer screening, we know it can be effective if you're diagnosed at stage 1. This graphic actually is from a few years ago, and thankfully things have changed a bit. Instead of it being 6 in 10, if it's stage 1, and if it's non-small cell, there are different cell types of cancers. If it's stage 1, then the range of 5-year survival is 70 to 90%. If you're diagnosed, however, at a later stage, less than 1 in 10 survive 5 years or more. So early detection and treatment, the type of work that Dr. Wolf and Dr. Flores do, does save lives. But screening has not been found to be effective for mesothelioma, ovarian cancer, or laryngeal cancer. Therefore, it's important to recognize the early warning signs. So what are some of these early warning signs? You know, some of them aren't specific. And by not specific, meaning it's not like I have this one symptom that's associated with mesothelioma or laryngeal cancer. One of the most common symptoms, and one of my mentors always said, the thing that you need to worry about is when someone says, I have this unusual fatigue, and it just can't be explained away. And it is right now, all of us are fatigued from COVID. I know that, and all of us have fatigue. But when there's an existential fatigue, that is something that you should always bring up to your doctor and have them do an investigation. But some of the other more classic signs are pain in the chest or lower back, shortness of breath. People think that they pulled a muscle and they don't understand it, because it'll be a specific pain, a pain when they take a deep breath. Shortness of breath, a dry cough, trouble with swallowing, feeling like food gets stuck, hoarseness, and unexplained weight loss. Now, peritoneal mesothelioma, which is a mesothelioma that occurs in the abdomen, can occur more slowly in terms of symptoms, because there's more room for fluid to spread before people are aware of it. But when people start having some abdominal pain, they have swelling or fluid in their abdomen, they notice, wow, I haven't changed my eating habits, but my pants are getting tight. What's going on here? Nausea and vomiting, constipation, or other change in bowel habits. Now, pericardial mesothelioma is exceedingly rare, but it still does occur, and that is often the early symptoms of that are chest pain, irregular heart rhythm, heart murmur, or shortness of breath. Ovarian cancer. Ovarian cancer, unfortunately, affects about 35,000 women a year in the United States, but there are no studies have been done that show that screening for ovarian cancer has made any impact on early detection. But it is important for all women to know that there are symptoms that may be associated with ovarian cancer. And this includes bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, and urinary symptoms such as urgency. I just read a story of somebody who was misdiagnosed as having a urinary tract infection or problems with their bladder, when in fact they did have ovarian cancer. Other symptoms can include problems with fatigue, an upset stomach, change in a woman's period if they're still premenopausal, difficulties during intercourse, constipation, back pain, and abdominal discomfort. Laryngeal cancer is cancer in the voice box, and that may be manifested with a sore throat that doesn't go away, pain when swallowing, trouble swallowing, ear pain, trouble breathing, weight loss, and people may feel a lump or mass in the neck because the cancer has spread to the nearby lymph nodes. Now, one of the important issues going forward is to think about the fact that many of these diseases take a long period of time to diagnose. So what we have is what's called the long latency period, meaning that you had an exposure. We heard about people who worked on their home 40 years ago, people may forget or people may not be aware. So it's important to be aware of potential occupational, environmental, and domestic exposures, because we know, as the World Health Organization has very clearly stated, and all of us know this, that no level of exposure to asbestos is safe. It's important to incorporate screening questions into a patient history. What we need to do is make sure that we document their past and present employment history. It's not just important to list what someone does for their living, but what they were exposed to. What types of exposures did they have? Were they biological, chemical, physical, or psychological? This extends beyond it just asbestos exposure, but should be something that we talk about with all our physicians when we have an annual visit or as frequently as you go to the doctor. Also, it's important to think about non-occupational exposures, hobbies, pets, smoking, travel, the home renovations we heard about. It's also important to talk about personal habits and hygiene products, because no one asks about cosmetic talc and the use of body powders until someone has mesothelioma. And I can tell you from looking at medical records from around the country, no one gets asked about cosmetic talc usage at all, unless they're going to one or two centers in the United States. So it's important to think about that if people do develop mesothelioma. So I'd like to thank you for your time, and I think there's going to be time for Q&A later. And back to you, Dr. Markowitz.
Thank you, Jackie. That was a great overview, very short period of time, but you covered so much, so thank you. Linda's asked me to announce that ADAO has received letters in support of the ban of asbestos from several U.S. senators, including Senator Merkley from Oregon, and also Senators Daines and Tester from Montana, which of course is where Libby is.